Rani, good morning. Safar, good morning. Shija, morning. Alright, so good morning everyone. And this is Varghese Thomas from Jeremy International Academy. And today we are here with live sessions for writing case note presentation. Hopefully, and this is a question from 25th of March 2023, and I hope there were many students were a bit concerned about these questions. And this is a series of live sessions, and it is providing all further informative sessions on a everyday basis, and we'll be discussing every exam questions paper and including other case notes which is students are most concerned about, and were feeling difficulties to provide the correct answers for it, and all those kind of case notes will be discussed in our live sessions. And I hope this is going to be an informative, and also this is an interactive sessions. So what I strongly recommend, all your concerns based on this writing or any other questions that you can share through your comments, and we will also be providing the answers for that. And well, Ajit, good morning. Amal, good morning. Jishnu, good morning. So I hope you have received the questions through our with our link. That is today we are going to be discussed with it, and it is a questions that has recently asked on the asked on 25th of March, and that will be discussed today. I hope everyone have received the questions, right? Joshi, good morning. Okay, so we'll be begin, and I'll just introduce a question first, then we'll be going through with our answers or sample answers. With that, we'll be discussing all the criteria how to implement on your letter writing, and what are the things you need to look forward for when you're receiving a question, or what are the focus that you should keep when you're making a question's answers. And we'll first begin with the questions. I hope you have the PDF right now. Um, well, so there is today's date, 8th of January 2023, and you are the nurse in the hospital who is caring Mr. James Mackey. Um well, we'll be going through the writing task. Well, since you know that once you receive the question, it has been very important that you need to understand what is a writing task for you. And using the information in the case note, write a referral letter to community health nurse Miss Wells, giving information regarding recent surgery and management, requesting post-operative care. Address this letter to Miss Minnesota Wells, Community Health Center, 12 Portugal, Brownsfield. So this is the writing task for you, and from this writing task it is very clear that you need to consider this information as a referral letter. To whom it is? To Miss Minnesota Wells, who is a community health nurse at the Community Health Center, 12 Particle, Brownsfield. So this is your writing task. So when you read the writing task, it is very important that you should understand what is this letter for, and to whom the letter is sending, or who is the recipient of the letter, and what is his or her role into your patient's care, or what are the or otherwise what are the care he need to plan for your patient. So this is very important to identify the answers for these questions, that is what type of letter it is, and to whom you are writing, that is who is your intent recipient, and what is the purpose of the letter, or what are the care he need to prepare for your patient's betterment or well-being. Oh, these are the questions that you need to be very clearly understand from your writing task. It will not require that you need to just read your writing task very rationally to cover your writing task page. It is not. When you read the writing task, it is very important that you need to look into the very deepest part of your writing task. Then only you will be understand what are the information you need to require to be on your letter. All right. So in this is very clear, that is you are writing to a community health nurse, that is Minister Wills, and she is going to provide the post-surgical care to the patient. So from this it is very clear that your patient has undergone some surgery, and this person is responsible for providing those care to this patient, right? So being considering to write the letter, you will be always the part of your writer of the letter, and Miss Wills, that she is the recipient of the letter, and she is required to provide all the care to your patient. But on a very honestly, when you have been considering that to have a proper letter or proper identifying what is the purpose, because many students are failed to identify what exactly the purpose is from your question, for which it will be very important that you need to consider that you are the recipient of the letter instead of a writer. All right. So when you consider that you are the recipient, so you can imagine or assume that I am Minister Wills and I am the community health nurse, and I am intend to provide the further surgical care to this patient, that is James Mackey, and then only you will be understanding exactly what the purpose of the letter that you need to be considered. So we'll be back to the case notes, and as you everyone knows that there are two major part of your question, that is case note and the writing task, in which case note deals with all the information of the patient. What is his past medical history, present problems, and what are the plan that you have done, what are the care that you have provided, and further what would be the discharge plan. All these things are clearly making from your case note, and further writing task which we already discussed about it. And from this writing task, a case note, what we are getting that you are the nurse in the hospital who is caring Mr. James Mackey, and his patient name is Mr. James Mackey, and date of birth age August 1947 and 76 years, residence Tall Particle Brownsfield, and phone number 0881241167. All right. And the social history: long haul bus driver, stressful life, diet poor, I don't know how to cook, that is the patient comment, and son lives nearby, stopped smoking 2 years ago, drinks alcohol 10 to 12 units weekly, however which is reduced to 1 to 2 units weekly for the last 6 months. Past medical history shows that he has acid reflux since 2007. Tonsillectomy, he underwent tonsillectomy. There is a medication history, that is omeprazole 1 per day for acid reflux. Family history, that is lung cancer for his father, and he died of kidney diseases for his mother. December 22nd, that is his initial visit to the doctor, visited family doctor due to unintentional weight loss 16 kg, that is over 12 months, indigestion, feeling of fullness of stomach, and one barfs a lot, abdominal pain, advised to do gastroscopy, biopsy, and CT scan. 24th December 2022, diagnosis of stomach cancer was made, advised for partial gastrectomy, patient is anxious. 28th December 2022, that is partial gastrectomy was done, closure wound with stapler, removal in 8 to 14 days, and PEG, that is jejunostomy, tube enteral nutrition via pump, NG tube, bowel function is moderately well, removal of fluid, decompression of stomach, removal of NG tube in 4 to 8 days. 5th of January, NG tube removed, managed with PEG till his calorie intake is sufficient. refer to a dietitian, semi-solid diet, avoid high fiber diet, stapler removed, watch for infection. Discharge plan, dietitian to review in 1 month, and further writing tasks we already discussed about it. All right, so this is a question, and I hope everyone has gone through, and now you will have a plan what to be on your answer sheet. It is very clear from this, but we need to understand what we supposed to do in it. So as we already discussed, that you are writing to Miss Miniso Wills, and who will be taking care of this patient's post surgical care. So what will be our introduction should be. So before we move into our introduction, and firstly, in your answer, it should be expand the relevant case note into complete sentence. Do not use note form. Use letter format. Letter should contain 180 to 200 words. So here we will begin with our letter writing. So initially we will be writing either because some students are following like first address and second address, date, today's date. So however that you can organize as per your convenience, it doesn't matter to OET letter evaluation. That is, either you can use address in the first, or in the date, today's date in the first. So what are the order that you have been maintaining on this format, it does not be a problem. So here I have used first with the address, that is Miss Miniso Wills, Community Health Nurse, Community Health Center, 12 Particle and Brownsfield. Then 8 January, reference Mr. James Mackey, date of birth 8 August 1947. Dear Miss Wills, this is another way of doing organization, because usually we may use with Dear Miss Wills on the first and reference on the next, but this order is also fine, and to show you that this organization is also better, then that's why I have used this. And well, we begin with the introduction. As you know that there is date of birth and as well as the age is already given in the question paper, so both you can carry to your answers. For that example I have used for the introduction, that is a 76-year-old man, Mr. James Mackey, who underwent partial gastrectomy for stomach cancer. Post-surgical care including monitoring surgical site for infection at your service would be appreciated. Alright, so I hope it is very clear for you. And here which I included that the age of the patient and the procedure which he already underwent for what, alright, that is stomach cancer. So what is being giving the idea to the reader, that is he will be getting is, because some students are using underwent partial gastrectomy for what, in the sense that question is raised by the recipient, so he will not be get a clear picture of, about for what he underwent the partial gastrectomy. Later on the paragraph, when you have been maintaining that so and so investigation was done and stomach cancer was made, so the reader has to reach that paragraph to understand what for the purpose that he underwent the surgery. Alright, so instead of, if you could make a clarity on the paragraph, that is the opening paragraph itself, that regarding the patient, his main medical issue and the purpose of the letter. So this three information, it has been very important that you need to carry to your introduction paragraph, that is the opening paragraph. The full name of the patient and main medical issue along with the purpose of the letter. So what you have to do that every after your introduction you should have a assessment or reassessment on it on your introduction part, whether you have used all three information which is required to your recipient. Yes, done. So I have used my patient's full name, patient's main medical issue, that is the condition which has been required the care, and further the recipient need to be followed. All right. So why the OET is being requiring that you need to provide the main medical issue, because patient may have many other diagnoses which the recipient need not to focus on it. All right. Out of, you need to find out what are the diagnosis which is very required to your reader, that to be considered as a main medical issue or the diagnosis which you should include on your letter writing. All right. So in which here the patient has undergone a partial gastrectomy for stomach cancer. So the reader is getting a clear picture on it, that is patient has been diagnosed with stomach cancer, for which he underwent a partial gastrectomy. All right, and a post-surgical care including monitoring surgical site for infection at your service would be appreciated. So these are the care which he required to provide. All right, so you can also provide further surgical care or post-surgical care, post-operative care, any paraphrase or synonym that you can include on your letter writing. I hope the introduction is clear. So also when you are being considering the introduction paragraph, you should focus on what are the criteria to be maintained. I hope the criteria is very clear with every student. So in which there are 6 evaluation criteria. The first one is purpose, second one is content, third one is conciseness and clarity, fourth one is genre and style, fifth one is organization and layout, and the last one is language. So these are the 6 evaluation criteria should be maintained on your letter writing. Out of the 6 evaluation criteria, at least a number of 5 evaluation criteria should be maintained on your letter. Then only it has been providing a chance to get a 350, that is a B grade, which is required for you on your examination. Alright, so on your purpose, it is very clear based on the recipient, whether recipient can do this. That purpose you should consider based on the diagnosis what the recipient is required to. Got it? Now we'll be moving on to the our further paragraph. Yeah, in between I am getting some questions. Can we write as recovering from? Perfectly, that you can do that is recovering from, because since the question says that the patient has improvement and patient is recovered well, wound is healed, and all those kind of categories mentioned on your question paper. So definitely you can use is recovering from. That is perfectly fine. And I'm so sorry because I missed some questions, and it will be better that at the end of the sessions if you could ask a question, so I think I will not miss any of your concerns, and that we can discuss at us in the best. All right, and I just wanted some answers from you. That is, the introduction is clear for you, or is there any more thing which I need to be discussed with you? Can we write recuperating after partial gastrectomy? Actually, you can also do that, recuperating, because it is just a synonym of recovering. So you can do that. So recuperating after, because it is kind of a question that should I write recuperating from or recovering after surgery? But the patient does the diagnosis is for something, or diagnosis can completely cure only with the surgery. Then or after the surgery the patient will be completely out of that particular diagnosis, then you can include recovering after, recuperating after, it doesn't matter. But surgery is only a treatment methodology for the diagnosis. Then I hope it is better that recovering from would be the best thing, because the diagnosis or the other part of diagnosis or the treatment is still pending. Then you can use recovering from or recuperating from, it is best. Yeah, all right. So shall we move on further paragraph? All right. So here, since you are been knowing that there is an acid reflexes since 2007, it is on the question, and we are considering his problem with the gastrectomy for stomach cancer, because acid reflux could be early signs of stomach cancer. That is the reason, because I have been begin with that particular past medical history on my paragraph. That is, Mr. Mackey has been on omeprazole for acid reflux since 2007. Alright, so it will be not so required that you need to include this information on the first of the first body paragraph, but it is, I feel it has been so required since it is a condition is called related with that, and that is the reason because I have used that particular sentence on the first. That is, Mr. Mackey has been on omeprazole for acid reflux since 2007. And he had visited to family doctor with unintentional weight loss of 16 kg over 1 year. So it is the question that has been giving that information is that because he has a huge amount of weight loss over a period of 1 year, and that has been very important, because it has been showing that it's unintentional, because the patient has not been trying to reduce his body weight, but very unfortunately his weight has been getting reduced, and that is the reason because it has been provided with unintentional weight loss of 16 kg over 1 year. And along with, there are some additional symptoms, because I have seen many students are following that the initial symptoms, what are the problem, that because of the patient has got admitted to the hospital, that will be written with comas. That is, a patient was hospitalized following an accident, head injury, vomiting, nausea and fever. All those things will be putting comma, and one by one other they will be following. So instead of that, it has been highly better if you could use the major complaints or the main complaint that you believe that the patient has got into your care. That things should be made on stand on a single, and then the additional symptom that he could use by extra, that is similarly what I have been used. He also experienced indigestion, fullness of stomach and abdominal pain. So this is the way that if you could do that, so it is something that the sentence would be most good and well, and also it has been high chance that the reader can clearly understand what you are trying to explain about, or what are the patient's major symptoms that he got into the hospital. That will be very clear. So you can use that he had visited to family doctor with unintentional weight loss of 16 kg over 1 year. He also experienced indigestion, fullness of stomach and abdominal pain. Subsequently, because there are plenty of dates which is given, as you all know that on the question paper that is given plenty of date, 22nd of December, 28th and 4th of Jan, 5th of Jan, 8th of Jan. So there are many dates. So it will be not required that every date that you need to be included on your letter, until unless if you believe that the date has some importance on your letter writing. Alright, so similarly that the surgery which is done on 28 December 2022, in before there were some other dates, that is on 22, 24, there are some other dates, but do you think that it has been very important to the reader to know that, so what exactly the dates was done, the patient CT scan and biopsy and all other investigation was done, and all this is not so highly required on your letter, and that is the reason because I just eliminated all the other dates since the surgery date has been very important, because the reader is providing post surgical care, and that is the reason because I have used that the reader is to know that when the surgery is when the surgery was performed, and that's the reason because I have made a sentence. Subsequently, stomach cancer was diagnosed and has undergone the surgery on 28 December 2022. I hope the sentence is clear. Yeah, can be used also to connect something, Sajida? Exactly, that you can do that. Definitely you can use on your letter, because it will be not like an informal connector, it is a formal connector. So definitely you can include on your letter writing. Fine, I hope it is clear, so we can move the further sentence. His nutrition status was maintained. His nutrition status was maintained through jejunostomy until his calorie is sufficient. Alright, so in the question it has been given that his nutrition status, there is a pump which has been connected to PEG, that is jejunostomy, and to be maintained until his calorie is sufficient. Alright, so his nutrition status also to be maintained, and his pump which is used for feeding, that is nutrition status, which is also to be continued. And also in the question paper which is given that NG tube has inserted for feeding and everything, and which will be removed after 4 to 8 days. So since it is already removed throughout your hospitalization itself, it does not be required that you need to be maintain that the sentence that the NG tube has inserted and all those things. Instead of further paragraph will help you how to maintain a sentence on it. A week later, because 28th and after, then we are talking about the 5th of January. So it will be not required that Devika Santosh has raised a question on can we use comma after therefore and for which. Definitely we will be discussing at the end of the sessions. So you will be having a clear picture on it. A week later, he has made symptomatic improvement. NG tube and surgical staples were removed. Alright. So with this sentence, that is NG tube and surgical staples were removed. So definitely the reader will be able to understand before on this day. Definitely there were NG tube and surgical staples after the surgery, and which is now removed, and additionally high fiber Okay. Additionally, high fiber to be avoided and semi-solid diet were initiated as per dietitian. Today, his wound, that is now something which we are trying to talk about, like the today's date, that is which is given on the 8th of January. That is today. Instead of putting the date, he can also paraphrase with today. His wound is healed. However, observation is required to rule out infection. So when you are being considering that particular infection, watch for infection, it is given on the question. Instead of that, you can use rule out. So rule out means it is something that we have to confirm that there is no infection. That means we need to be excluded. There is no such of infection on his wound, and he also need assistance with pump since PEG tube to be continued. All right. So that nutrition status to be assessed in every time that the pump, also the carer, that is a recipient of the letter, to provide further assistance on the pump since the PEG tube, that is jejunostomy tube, to be continued. All right. Then as per on the discharge plan, it is given that a dietary review after 1 month would be most appreciated to monitor Mr. Mackey's compliance with nutritional regime. All right. So as per the discharge plan, there is only one discharge plan which is given, that is to monitor his nutritional regime, and we are providing a dietary consultation as well. And for what reason? In the sense that purpose should be mentioned very clearly, because most of the letter it has been given that a neurology consultation is required after 1 month. All right, that only will be written on the question. But from the case that we need to identify what is the purpose of that neurological consultation, that also we need to be included on your letter. It will be not good enough that if you are writing only that a neurology consultation is required after 1 month, or neurology consultation has been scheduled after 1 month. But for what? In the sense that question is incomplete on your sentence. That is the reason, because you need to find out what for the nutritional assessment. So it is something that complies with the nutrition regime that to be followed, and that is the reason because a dietary review after 1 month would be most appreciated to monitor Mr. Mackey's compliance with the nutrition regime. So that thing also you need to be mentioned on your paragraph. Then definitely it gives a complete sense of sentences that on your paragraph. Then feel free to contact me if you have any queries. Yours sincerely, Nurse. So when you have been, I have been seeing that many of the recommendation paragraph, it has been give you that it would be appreciated if you could do so and so things, or pertaining of the above, or upon discharge, all these kind of cliches, templates which is being used on your paragraph. I strongly recommend, if you are expecting good scores on your exam or the writing practice in every day, it has been very important that you need to avoid all these kind of cliche sentences or the templates that which you typically need to avoid from your letter, and that gives you a better idea on your letter writing. Also similarly on the introduction, that every students are writing, I am writing to refer Mr. So-and-so, instead of if you have been taking another sense of sentences that what you are trying to recur, even with the patient name, that has also been good in having introduction. All these kind of changes that you need to be included on your letter. And what do you have to understand, because every paragraph it has been logically has to be divided. Even OT has been not recommended that you need to give a 4 paragraph, you need to provide 5 paragraph, 6, no more than 6, it is not. Basically OT is requiring that you need to provide, you need to divide your information into different paragraph on a basis of logics. It is not the matter of that the information that you have to include on your letter on this particular paragraph, because some at least the student, when we are receiving the student from other institution, particularly they will be following introduction as in the first, and then present medical history on the second, and third is on the social and the past medical history, and likewise this is in a prefixed order which has been providing to the letter writing. I humbly requesting you that please don't follow all those kind of structure, because OT is not being following a structured paragraphing on your letter writing. It will be required that based on your purpose of the paragraph, based on the organization which you are be requiring to your letter writing, it is only the way of doing your paragraphing. It is not because of the information wise that you need to not to provide your paragraph. It is only your purpose oriented paragraph should be made up. Alright. I hope it is very clear. I just wanted to ask you, is there any more concern regarding on this question? Now we will have a discussion on it, and if there is any kind of concern that you are having, and also I recommend that the closing sentences, it has been not required that every time if you have any queries, feel free to contact me, or please do not hesitate to contact me. So if you could change all those typical sentences that you have been using since many years, so and you can replace with this. And if you believe like your paragraph is gone up with most of the word limit, and then it will be not required that you need to make a sentence over here. You can use only kindly do the needful, and that is also best for your letter. And some people are a bit concerned about yours sincerely, yours faithfully. Even the textbook, that is OET books, are saying like if there is a recipient on your paragraph, the name of the recipient, then you can use sincerely. If there is not, you can use faithfully. But there are some additional measures that you can use: warm wishes, best wishes, with regards, best regards, and all those things can be used. And also you need to understand, if you be using any sincerely, faithfully, it is not a criteria to reduce your marks or gain your marks. It is only the paragraph and the organization what you have been using on it. And if you are using only the informative sessions on the relevant data, that will be gives you the best marks on your letter writing. It is not based on anything. That is the criteria to be followed. So whenever you are practicing a criteria, your letter writing as well, so you should follow all the criteria has been made up, because even though there is a 5 criteria bar which is on the OET evaluation, but still that you have to follow all the criteria should be implemented on your letter writing. Then only it has been important that you will be able to provide all the necessary information to your letter writing. I hope it is clear for you, and be with what are the criteria which should be followed, and each of the criteria, because some of the students which I have feel like it will be very important that there are one criteria, that is genre and style, in which the tone of the letter should be formal, that is informal words or the connectors should not be used on your letter writing, and also a formal way of writing should be done. And formal way of writing should be along with the factual information should be made up. When you are writing the letter, factual information in the sense like truth sentences, that is where we will be getting this factual sentences, that is from your question paper. If you believe that particular sentence is given on the question paper, then you can paraphrase into your answer sheet. It is not the meaning of that your personal opinion or the judgment can be included on your letter writing. It is not. Alright, so what are the information which is given on your question paper, that only you are supposed to take from your question and to your answer sheet. That is, you can convey into any way, like your totally you can paraphrase or you can use the sentences synonyms, that perfectly alright, but only thing is that the information should be very clear and the fact information should be used, and also professional letter writing should be made up, because in which the people are be using some investigation, that is CT scan. Do you require that you need to use a computer tomography instead of CT scan? Actually, there are for example, when you are writing the letter, you should always consider the discipline of the recipient, because here we are having a community health nurse. So do you believe instead of CT scan, do you require to explain computer tomography to a nurse, those who receiving your patient? It is not required, because I don't even believe, being a nurse, I don't even believe that a CT, it will be not familiar, and the computer tomography is familiar to the all the healthcare professional. It is perfectly not, because instead of computer tomography or magnetic resonance imaging, MRI and CT scan would be the most familiar to the people from healthcare sector. So you should think about, like, if you are the recipient, will CT scan is clear to you, then you can write CT scan over there. All right. If you believe that the recipient, that is discipline of the recipient, not meeting the knowledge up to that CT scan, then you can elaborate to your full form of that particular abbreviations to your letter. Otherwise, abbreviation is highly accepted on your OET letter writing. It will be not required to maintain on it. All right. So I have received a question from Anaka. So in main body paragraph, can we mention the purpose content like underwent the surgery? Perfectly, you can do that. Main paragraph, I believe that you are considering for introduction or in the body paragraph. I'm not clear with the question, but still I can say that on your introduction paragraph, even that you can underwent, you can use underwent so-and-so surgery, and what exactly the purpose is required from your for your recipient, that you can include on your letter. Because when you have been considering this criteria, it has been very clearly mentioned that if you required 350 marks, or if you required the B grade, what are suppose you need to do it. It should be very legible, and it should be clear to the reader, and it should be perfectly explained and properly expanded. If you could do that, then it is high chance that your score will be above 350. And always you should focus on the two paragraph, that is your introduction, that is the opening paragraph, and as well as your first body paragraph. If you could do this, definitely your things will be done. All right. So these are the common thing that you need to focus on it. And I think there were a previous question that we are having. Devika Santosh, that can we use comma after therefore and for which? See, always you need to think about when you are putting comma, the two types of sentence, that is the dependent and independent sentence. If you are using a dependent sentence on the first, then even after connective you have to put the comma. If you are using an independent sentence on the first, and then you are using so-and-so connective, it will be not required, or the comma is not required after the independent sentence. So you always have to understand, it will be not, if you wanted to know about your rule of comma, then it will be very required to understand about what is dependent and independent sentence, is for which you need to focus on types of sentence, that is simple, complex, and the compound sentence, that you need to be very familiar with it. And I think the further what we'll have a grammar session in which it will be clearly mentioning on it. So what are the comma rules which has been focused on it. But I strongly recommend, if you are putting a comma, and if you believe if you are using therefore, and if you believe there is a pause after it, definitely you need to put the comma on it. Rustin, what about the medical and social history? Don't we need to mention it? See, basically here all this past medical history, because which we already mentioned on it, that patient has acid reflux, and that acid reflux, which we already mentioned, and additionally there is a tonsillectomy history. But a tonsillectomy history, because it has been not clear that when it has been underwent, and it has been not required to your letter, because tonsillectomy and this current scenario, it has been not required, and that is the reason, because it can be avoided. When it comes to the social history, you can include that habit of alcoholism, even though an ex-smoker, that you can include on your paragraph, because more on, I believe that the other information are high priority, and that is the reason, because I have excluded that. But in your letter, for the organization purpose, that you can include that alcoholism habits and smoking a smoking habit, that can be included on your letter writing. Vishnu, what is difference between sincerely and faithfully? So OET refers that if there is a recipient name on your question paper, that is here we have on the first paragraph, as I'll be taking to the address paragraph, you can see that Miss Minizo Wells, there is a name which is given for the recipient part. If so, at the end of the letter you can use yours sincerely. And imagine there is no names on the address part, and we are begin with the community health nurse. There is the designation, we are begin with your letter. Then you can use yours faithfully. I hope it is clear for you, Mr. Vishnu. Ajit, Manoj, could you explain more about the organization? Exactly. So when there are basically three sets of organization that we can use on your letter writing. The first is based on the scenario which has happened. All right. So the event which has been given, like there are so many dates which is given on your question paper. You can either organize based on the question paper which is been organized. The based on that you can as per the order which is given on the question, that you can do that, and that the organization either you can do that, or the second type of organization which you can be used as per the importance. All right, there are plenty of visits, and if you believe the last visit is something, because of that you are trying to refer this patient to the neurologist, and you can consider that visit on the first. All right, as per the priority wise you can do that. And the third one is a problem solution order. If you could use a problem solution order, in the sense if you are having a problem with the patient, in the sense the patient has a problem initially and you are managed with something treatment. For example, a patient initially visited with headache and you provided a paracetamol to the patient, and next day he revisited with severe headache, and you have provided some other medicines. On the third visit he came with a severe headache and following a fall, and there is suspecting a head injury. And if you wanted to have an organization that is which has happened, then you will be considering first that on his initial visit he complained about the headache and you have provided so and so paracetamol, and revisited on the next day with so and so problem, and today he came to the hospital following a fall, followed by headache, and upon your examination there is head injury was noted, and therefore you are referring this patient to the neurologist, and this way that you can do that. If you are feeling like the organization to be made upon today's visit, that is because of the head injury, and that you are considering that as a most reason because you are referring that patient to the neurologist, then you can have an organization based on the today's visit. I hope it is clear for you. If start with dependent sentences, then we need to keep comma before the second sentence. If you are started with dependent sentence, for example, I can give another best example for you. Most of the people are closing with the letter that if you have any queries, comma, please do not hesitate to contact me. All right. So this we can consider to find out what are the dependent and independent sentence. So if you have any queries, so that we consider to be an dependent sentence, because if I say if I am telling you that okay, if you have any queries, so if I am stopping the sentences over there, then you will have a written question, that is what should I have to do if I have a concern, if I have a question, if I have queries, what should I do? The sentence is getting incompleted. Instead of if you have any queries, comma, please do not hesitate to contact me. That please do not hesitate to contact me considered to be an independent sentence. Just make it a vice versa. That is, if you are using if please do not hesitate to contact me if you have any queries, there is no required to put the comma in between the sentences if you are putting the incomplete sentence on the first. I hope it is clear, Shija. In non-case, is there any difference in word count? Basically, each question is designed by OET that the word limit will be mentioned under the question. That is the important point which you need to follow, because there are some sentences, some questions as made instruction that the word limit can be 200 to 220. There are some letters, but most of the letter we can expect that the word limit is 180 to 200. So there is basically no difference between the known and unknown cases letters, because each question is designed based on the word limit can be reached up to on the instructions which is given on your question. I hope it is clear, Tina, because you always have to, because it will be not only good enough that you are focusing on the case note and the right hand task, it is also be required to note on the instruction which is given below, that what are the information the recipient required to be, and what are the word limit and given in the question paper, that is also required. I'm writing to request home care services for Mr. So and so who underwent so and so surgery. He requires post surgical care and management. Is the above purpose is correct for the letter, sir? Because see, Western, basically up to the question, up to your question, the sentence is correct. But what are you supposed to do that? If you are writing to a nurse or the doctor or the healthcare professional who is supposed to a person to provide the post-surgical care, then your introduction is perfectly right. Just imagine if your letter is to a social worker and if you're asking to provide a post-surgical care, do you think a social worker is a person to provide a post-surgical care to the patient? So you always have to think about who is your recipient, and based on the recipient part you need to think about what the introduction and what the purpose you need to do it, and also along with that you should consider what is the main medical issue of the patient. All right, I hope it is clear for you. If you have any queries, please contact me. Please contact me if you have any queries. This is correct. Exactly, Shija, it's perfectly correct. So you can do accordingly. You should think about if the dependent sentence is on the first, then you should put the comma after that. Then you can continue with the independent sentence. If you are putting independent sentence on the first, it will not require that you need to put a comma. After that, you can continue, make it make it one sentence that you can do it on your letter. Got it? Yes. Is there any more concern that you are having? Well, Shija, since it is clear for you, very good. Okay, so I think it is well and clear for you all. Christian Jones, can you please explain about pin codes when you use a comma and hyphen? Yeah, exactly. So Christian, when you have been using, for example, I can make an example from Calicut. Okay, the Calicut, what we are located in, the pin code is 673004. All right. So when I put the Calicut, comma 673004, I'm using the comma between, because with the pin code, if you are searching in the Google itself, it will be showing the where the location is. All right. For example, the Calicut and the particular location and the pin code showing the same answers for you, and that is the reason, because it's a comma is being putting in between that. It will not highly require that, but if you are putting, that would be most appreciated. And also there are some similar concern has been asked by the students, that is, do I need to put 808 August 2022? All right. So do you require to put a comma after August? So both format is perfectly correct, because OIT is requesting you that you can use the format as per your local context. It will not require that there is a fixed format for your dates and all these kind of things, pin codes and everything. So what the local context is recommending you, that you can use on your letter. All right. So 8th August comma 2022 is perfectly fine. 8 August 2022 without comma, it's perfectly fine. Calicut comma to the 673004 is correct, and it is best done like this way, that if you could do it, it is perfectly fine for you. All right. Can this be used? Glad to assist you for further queries. Perfectly do that. because it is not a way that the OET is not recommended that you need to follow only one sentence on your letter, any paraphrasing. I respect being a trainer, I respect you if you could bring all these kind of new sentences instead of all this cliche to your letter. It will be best for your things on your letter writing. What is the difference between undergone and underwent? Divya, basically there is no particular difference, only because of the tense difference. When you be using underwent, it is very simple past, it will be given underwent. Instead of, if you believe that the surgery has recently done, then you can use has undergone, or it is in the past which you can use had undergone. That's it. There is no further difference between that, you can do that. In this letter, this was a referral letter. So in simple, it is not mentioned referral letter. Type of letter needs to mention in the introduction paragraph. Please explain. Definitely, Shija, this is a wonderful question. I hope you will be following all this OET official website, because in which OET is recommended. The OET education has been recommending that it will be not just enough that if you have been mentioning referral, transfer, non-case on behalf letter on your introduction, this will not give a proper purpose of the letter to your reader. That means if you are just, because of your mentioned referral, I am not mentioned that particular referral, will the reader get a clear picture of what is the purpose of the letter from this? So it will be not required that you need to write in every time I'm writing to refer so on, so it will be not required. If you are using this way, it is also perfectly fine. So with the word of referral, with the word of transfer, all this, the reader is not going to clearly get the picture of what or why you are writing this letter. Alright, so it will be not so highly required. Has undergone present, like exactly, has undergone, and this is recently the patient has undergone the surgery, then you can use has undergone perfectly. Then is there any more questions that you are having? I hope the session got a bit useful for you, and definitely we are providing further sessions similarly based on every task which you believe that it is a bit difficult for you, and our further session will be on upon the writings. And also, if you are having any particular preferences at any of the material or the module which you are required to have sessions similarly, that definitely we will be making on your live sessions every week. And so can you please say more about recommendation paragraph? Recommendation paragraph is very clear, because basically OET does not have a title of recommendation paragraph. Recommendation that can include even on the previous paragraph, the sentence is well and good and organized, that you can include it. And if you have been using the recommendation paragraph with it would be greatly appreciated if you could do so. These kind of cliche sentences to be avoided instead of your own sentences. For example, hoping your expert care would be beneficial for his speedy recovery on so-and-so based on so-and-so ground, that you can do that. Or else similarly, your detailed care upon so-and-so requirement would be appreciated, you can do that. Your empathetic care, because some of the sentences, some of the question has been asking you that you can use provide empathetic care to the patient. So instead of requesting provide empathetic care, so you can also convert in other sentences that your empathetic care would be beneficial for so and so. You can do that. Alright. So this is the way that you can make the recommendation paragraph. I hope it is clear for you, Sangeeta, right? Okay. So these are the things, and in our institution, that is Jeremy International Academy, is providing all the case notes and as well as speaking sessions as well, and we will be providing further speaking role plays. And I hope with this sessions you can freely go to your examination, and you can get the good scores on your exam. And also you can implement these things, these tips and strategies to your daily practice, and it is going to be helpful for you to maintain a proper letter. So always I'm just emphasizing that is you need to focus on 3 questions on your introduction, that is to whom you are writing the letter, what is a main medical issue. I'm just keeping your attention on it, that is there will be a lot of medical condition in which you should find out what is a main medical condition for the patient, and as well as what is the main purpose of the letter. If you wanted to understand what is the purpose of the letter, then you should think about to whom you are writing and what will be his role onto your patient's care. All right, and also be confident to think about that you are the recipient of the letter. Actually you are the writer of the letter, but you should assume that you are the recipient of the letter. Then look into the case note, so you will be understand what are the information should be considered to your letter and what exactly other to be removed. All right, so I hope this will be clear for you. And if there is any further question, you may please personally contact us. We will help you on it. And if there is any further concern that you can ask in typing messages, we will be answering you, or you can personally contact us. We will be located in Kottayam, Cochin, Calicut, and other location of Karnataka. And also if there is any further concern, that you may contact us in personally, or you may visit to our institution, any of our branches, and our trainers are there to help you. And that's it, and I hope it is clear and informative for you all. Please wait and watch for our Facebook and YouTube pages, so you will be getting further informative sessions as well. Thank you, and I wish you a great day for you all, and you can also further approach to your exam very freely. Thank you.